These deaths were the impetus to motivate community to begin to count the dead, archive the dead, recognize the dead. And we do that every year. Political leaders have joined us, but governments are lagging behind in data collection. We're still relying on community-led data collection projects. And this creates a number of downstream effects in policy neglect in policy areas that can be directly traced back to a lack of systemic data collection on the part of government. Often, in the eyes of policymakers, if there is not data on an issue, the issue does not exist. It's a fundamental issue.
Welcome to Perspectives, a Canadian journal of political economy and social democracy. I'm Clement Nokos, editor of Perspectives Journal and director of policy at the Broadband Institute. Data, or counting the number of occurrences or costs of things, is an essential tool for shaping government policy, and without it, an issue may as well be invisible in the eyes of policymakers. This is the argument that policy researcher Dylana Thompson makes in her new piece published in the latest issue of Perspectives Journal, issue number 2, released this fall, entitled Counting the Dead, the Urgent Need for Coroner's Data on Trans Deaths in Canada. She's also the principal researcher for the NDP's white paper on the status of trans and gender diverse people, published last year, laying out real solutions to the problems being faced by these communities. From her policy white paper, policymakers must take an intersectional approach that is sensitive to differences in the circumstances of trans and gender diverse individuals and communities, and differences in forms of hate and exclusion directed against trans and gender diverse people. Colonialism, racism, transphobia, misogyny, poverty, ableism, and ageism are all factors that continue to shape who and how people are marginalized within 2S LGBTQIA+ communities. Data keeping is necessary for public policy that protects trans people and other marginalized communities facing discrimination and repression. It helps us to understand how policy agendas are negatively affecting marginalized communities on the one hand, and it also helps us see other issues affecting marginalized communities that would otherwise remain invisible. Dylana Thompson joins us now to chat about her new article in Perspectives Journal number 2. Dylana, thank you for joining us on the Perspectives Journal podcast.
Thank you for having me, Clement.
At the time of this recording, we're coming up on the Trans Day of Remembrance, observed on November 20th. How did the events surrounding the first observation of the day in 1999 develop into a data collection project?
Trans Day of Remembrance was inspired by two tragic deaths of two Black trans women in the Boston area in the 1990s, Rita Hester and Chanel Pickett. Hester's and Pickett's murders were separated by years, but there were many similarities between the two murders. And activist Gwendolyn Ann Smith recognized this and thought this must reflect a broader systemic issue. So she went about collecting and archiving all known murders reported in the media going back to the 1970s and organizing two sister vigils in Boston and San Francisco of that year. The day has grown since then. It's observed internationally by many levels of government, by many communities, by many political leaders. And despite that, we still have a long way to go on addressing this issue. So Hester's murder remains unsolved to this day, although last year the police did commit to reopening the case and reinvestigating the case. There has been neglect of this murder. That's not dissimilar to many other murders of trans people, primarily trans women of color. And in the case of Pickett, her killer was acquitted of murder using the trans panic defense. Listeners might not be aware of what that is. This is a defense that is successfully employed in courts to lessen sentencing and related to killing trans women, where the killer, often a heterosexual man who is intimate with the victim, will employ transphobic and homophobic tropes to say, this person threatened my masculinity by tricking me into being gay. Often I'm misgendering along the way. This person was a man, tricked me into being intimate with him, and the courts will. So I was thrown into a fit of rage and I was not in my right state of mind. And courts often accept that is a policy issue. Men can kill trans women with impunity often. So that's the background of those two deaths. So these deaths were the impetus to motivate community to begin to count the dead, archive the dead, recognize the dead. And we do that every year. Political leaders have joined us, but governments are lagging behind in data collection. We're still relying on community-led data collection projects. And this creates a number of downstream effects in policy neglect in policy areas that can be directly traced back to a lack of systemic data collection on the part of government. Often, in the eyes of policymakers, if there is not data on an issue, the issue does not exist. It's a fundamental issue, data collection.
What is then the state of current data keeping around trans and gender diverse communities, in particular regarding the deaths of people from these communities?
So yeah, as I mentioned, politicians are recognizing the issue, but they are failing to collect data. We continue to rely on the work of activists and NGOs to collect death data and compile it into databases. Every year, we report on international data provided to us by Transgender Europe's Trans Murder Monitoring Project. But this data is incomplete. There are many flaws in the data that come from the fact that Transgender Europe doesn't have the arms of government to create comprehensive, accurate data. Transgender Europe essentially monitors news reports internationally and compiles all reported deaths into a database. And there are many issues and limitations with that methodology. It is unfortunately not uncommon occurrence for media, police, and even death investigators to dead name and misgender trans homicide victims. Dead naming and misgendering being referring to the trans individual by the gender they were assigned at birth and the name they were given at birth rather than the name they went by when they were killed. So that this act, aside from being transphobic, leads to an erasure of trans people. Oftentimes, the initial media report will get the identity wrong, and the onus lies on frontline serving organizations to correct the record. To be like, no, that's not the name of the person, that's not the gender of the person. That person was trans. You need to report that. And that sometimes will make it into future media reports, and then that will filter into the Transgender Murder Monitoring Project. But other times it doesn't. There is likely a urban bias in the reporting of these murders because of the reliance on NGOs to correct the record. There's a high concentration of nonprofits serving trans people in urban areas, less so in rural areas. And we know from census data that there's a not insignificant number of trans people living in rural areas. As well, some murders or some deaths don't get the public outcry and media attention that other deaths do. I think an obvious example of that would be deaths in prison. There's atrocious levels of violence in prison, and it often doesn't leave the prison walls. We don't know about it outside of prisons. Very safe assumption that there is an undercount of trans people who've been murdered in prison each year. So last year's Trans Murder Monitoring Project data shows that 321 trans people were murdered across the globe. Characteristics of many of these victims share similarities with Hester and Pickett. In total, 94% were trans women or trans feminine, 48% whose professions were known were sex workers, 80% were racialized, and 77% were between the ages of 19 and 44, with most being under 25. In Canada, between 2008 and 2023, there have been 11 recorded homicides in the available international data, but for reasons I've already mentioned, that is likely an undercount. The true number is likely much higher. So Canada was the first country in the world to begin recording trans people in census data. That was a big step forward, but we still have a far way to go. Often in government surveys, I've noticed a pattern where trans men will just be collapsed into the man category, and trans women will be collapsed into the woman category, and then we'll have an other category for people who identify as neither men or women. But that's continued erasure, and it's going to have a negligible effect on general statistics of men and women, because general population of men and women is much larger than the population of trans women. So just mathematically, that's just continued erasure, but we're acknowledging, at least the government in those surveys is acknowledging the people that we're not really counting properly. Other times, there'll just be a total neglect to mention that. We're starting to get better to recognize the existence of trans people in surveys, but there are still some government surveys where just trans people aren't included at all. And in other cases, the government will say, well, we have this data, but we can't present the disaggregated data because of privacy concerns or we can't draw statistically significant conclusions from sample sizes that small. So we definitely need to find ways to innovate to measure this population, because this population continues to be erased in government surveys. And yes, and to disaggregate. So sometimes as well, government will present trans people as some homogenous group in data, and they might say men, women, trans people. The issue with that is it erases so many other differences within group, and those are relevant differences. For example, in the case of death data, there was a study in the United States that examined all-cause mortality rates of trans people. It found that there was a mortality rate twice that of the general population. We don't have a similar study in Canada to point to, but there are reasons to assume that a similar pattern exists in Canada. But when you look into the granularity of that data, there were differences between gender. So trans men, trans masculine people, much higher mortality rate at a younger age, often attributed to self-harm and suicide attempts. For trans women, trans feminine people, the mortality rate persists across age ranges, attributed to different causes as well. So substance use, homicide, chronic illness. As there are other studies you can point to that show inequalities between races, as well as socioeconomic factors leading to inequalities. So just presenting this highly diverse group of people as one group trans, and that's the data, that's how the data is being presented, that can erase trends as well. We also have data on income and employment discrimination as well. The federal government recently recognized this data in a report recommending updates to the Employment Equity Act. They've yet to update the Employment Equity Act to include 2S LGBTQI people, but they've recognized extreme levels of poverty among trans people. And they recognize the need to disaggregate that data. And when you disaggregate that data, just like with mortality data, you see differences between gender, between race, between many other factors that lead to differences in income, differences in experience of employment discrimination. We don't collect data on sexual violence in prisons historically in Canada. We have not systemically collected that data. Another issue where out of sight, out of mind, we don't collect the data. Okay, not an issue to government. We don't have to do anything about this issue. But data from the United Kingdom, where they do collect this data, and there's a lot of misinformation out there circulating that to support some really violent and draconian policies in regards to the incarceration of trans women, but just claiming that trans women are just as much a risk to cis women as cis men. But the data from the UK paints a different picture. It shows that trans women are sexually assaulted in men's prisons consistently on a monthly basis. And violence is a general issue in prisons, and we have to implement policies to make prisons a less violent place for sure. So sexual violence is an issue in men's prisons, it's an issue in women's prisons, but trans women do not commit sexual violence at a higher rate than cis women prisoners in women's prisons. In the UK, they found that there is a sexual assault from a trans woman in a woman's prison, maybe once every 2 years. So that's equal to the general rate of assaulting. Yeah, so internationally, as I mentioned, the international data is imperfect. But from what we do know from the data internationally, some regions have much higher rates of lethal violence than others. In Latin America leads the world in reported trans murders each year. One organization estimates that the life expectancy for a trans woman in Latin America is 35. And Latin American trans feminists have done a lot of thinking on this issue. So trans feminism is a kind of feminism that centers trans women, and it considers, the liberation of trans women to be central to the liberation of all women and people more broadly. Because when we address the systems and policy decisions that impact trans women, we are going to better the lives of so many other people. Latin American trans feminists actually put a name to this phenomenon of killing trans women. They call it trans femicides. So the killing of trans women, often racialized and working class trans women, because they're trans and because they're women. So the lack of systemic data collection, it sort of creates a sense in government, trans people don't really die because we don't count it. And that creates a self-fulfilling prophecy. So trans people don't really die, we're not counting it. So we're not going to do anything to address this issue. So trans people will continue to die preventable deaths.
I hear a little bit about this intersection between data collection and the need for it and creating effective public policy. So what can effective data collection of trans deaths tell us about the effects of public policy choices?
So if we had government collected data, so data collected with the resources of government, we would have data that could paint a richer picture that expands the focus beyond the demographic characteristics of the victims of lethal violence towards the perpetrators of violence. Maybe we can shift the focus to the perpetrators of violence. We can just paint a bigger picture, and we need a bigger picture to have comprehensive policy to address this issue. But we should also, recognize that a lot of the attention has been on murder, and it's essential that we do not decenter this issue that primarily affects Black, Indigenous, and racialized trans women. But there are many other causes of death that remain uncounted by government and therefore ignored by government. The statistics on suicide are limited in Canada, but the statistics we have that are available paint a pretty stark picture on the precarity of trans lives. So a 2015 study in Ontario found that 35% of trans people in that province had thoughts of suicide in the past year, and 11% attempted suicide. To put this statistic into context, 2.6% of Canadians had thoughts of suicide, and 0.3% of Canadians attempted suicide in 2019. Suicide is the second leading cause of death for youth generally, and trans youth in particular are at an extremely high risk of suicide. One study from Canada found that trans youth are 5 times more likely to attempt suicide and 7.5 times more likely to consider suicide. These statistics are not an inevitability. This research also shows that suicidality is linked to a number of things, including social support, including socioeconomic status, including access to gender-affirming healthcare. And these are particularly for trans youth right now. These are factors that are under attack by conservative governments that want to really distract from their poor record on other issues. And they picked a scapegoat that they feel are easy to pick on. Statistics show that this transphobic policy agenda that's being embraced by conservative politicians in Canada have deadly outcomes. And we see this in other jurisdictions who have gone down the same dark path. So policies that ban evidence-based, life-saving healthcare for trans youth, this is not new. This healthcare has been around since the 1980s. Evidence shows that when politicians decide to take this care away from youth, there's up to a 72% increase in suicide attempts. Similarly, the UK put restrictions on puberty blockers, and advocates there are pointing to an epidemic of suicide among trans youth. The situation for trans youth is worsening because instead of improving life for everyone, conservative politicians decide to spread misinformation and hate and divide in provinces like Alberta. Thankfully, recently, we've seen that this agenda be rejected in New Brunswick. TransPulse Canada data shows that only 26% of trans people have all their gender-affirming healthcare needs met in Canada. And that this shocking statistic is due to a couple of factors. There are only 2 jurisdictions in Canada that have aligned their gender-affirming care policy with expert recommendations that all levels of government claim to follow in regards to gender-affirming care. And those jurisdictions would be the Yukon and Prince Edward Island. If jurisdictions the size of the Yukon and Prince Edward Island can provide all the necessary care to their trans residents, any province can do this. It's a choice not to. And provinces in Canada can definitely do better on this. As well, there are long wait times in many provinces for the few procedures that are offered. So these wait lists can be years long. So gender-affirming care programs are underfunded, and they don't cover nearly enough procedures to properly transition trans adults. And this is a very serious thing. Other data from TransPulse Canada shows that when trans people can fully medically transition, if that's the path that they need to go down, there is a 64% reduction in suicidal ideation. And other factors such as social supports, better income, improving socioeconomic status can really normalize those suicide statistics and bring it in line with the general population. So yeah, these high suicide stats, they're not an inevitability. They're a result of policy choices. Public opinion is intended to be the safeguard against frivolous use of the notwithstanding clause, but to have public opinion to protect against governments oppressing citizens, we need to have citizens that understand the implications of policy outcomes. And I don't think any of us really understand the full scope of these policy outcomes because we don't have the data collection to support that understanding. But if we were to systemically collect trans death data, when governments in Alberta decide to ban life-saving healthcare for trans youth, we would at least have a record of deaths, and it would make it pretty politically toxic to invoke a notwithstanding clause to override fundamental human rights of a group of people. So far, we've only seen Saskatchewan invoke the clause to protect their transphobic policies, to protect at-risk students in schools. But Alberta has expressed a willingness to go down a similar path if needed as well. The federal Conservative leader has also expressed a willingness to just run fast and loose with the notwithstanding clause on a different issue. But I could see a future Conservative government going down this path for a nationwide ban on puberty blockers. Pierre Poilievre has expressed support for this policy after his membership endorsed it at a convention. If we had data, I think Conservatives would be less willing to play cynical games with trans lives.
What then is a path forward for policy change on this issue? And, I encountered this NDP white paper on the status of trans and gender diverse people last year. Could you tell us more about that NDP white paper?
So this white paper goes beyond the scope of the discussion we've been having today, touches on a variety of issues, 29 specific policy recommendations to move trans rights forward at the federal level. I had the honor of working as a principal researcher on this white paper in Member of Parliament Randall Garrison's office. And I should say he does great work. He does great work for the queer community and great work on a number of other issues. This is really a roadmap towards fulfilling the promise of equality that the government made when the government updated human rights legislation in 2017. Just to give a sense of the scope, and I definitely recommend listeners check it out. We touch on issues of gender affirming care. We touch on prison policy. We touch on sex work. We touch on violence. We touch on HIV decriminalization. So many people come to Canada, so many queer and trans people come to Canada as a safe haven, fleeing transphobia. I think we owe it to people fleeing transphobia and homophobia to welcome them into a place without transphobic policy. So we highlight the need for updating policy for trans refugees. We highlight so many other issues. This is a whole other discussion, a whole other podcast for sure. But yeah, the white paper has cross-party support, thankfully. So there is support in government. We're not seeing enough action from government, but there is support in government for this policy, as well as support from labor unions. So it's been endorsed by the Canadian Labour Congress and a number of unions, queer civil society, and nonprofits more broadly. There was a official petition run in support of the white paper that garnered over 10,000 signatures. So there's also support among Canadians generally. In regards to trans death data, I think there's a pretty simple step forward. All provinces could implement this. It's not costly. California became the first jurisdiction in North America to run a pilot project in 2021, a 3-year pilot project. That project is likely coming to a close soon, and we will have lessons from that pilot project. Training coroners in the post-mortem identification of trans people and mandating that reporting in coroners' inquests. So in 6 counties in California are currently doing that, and provinces and territories in Canada can do the same. Research shows that this is a feasible policy initiative. We've studied the feasibility of this. We can train people in the post-mortem identification of trans people. So trans people are counted when we're dead and not erased. So we can implement this across Canada. As well, as I mentioned in a previous question, we need to do much better on gender affirming care. We can do so much better. The NDP is the party of Medicare. We're the party of universal health care ever since Tommy Douglas. But we've really not been going as far as we ought to on the issue of comprehensive gender affirming care. At the time of recording, we still haven't counted all the ballots in British Columbia, but I remain hopeful we will have a third term of a BC government, and BC has an opportunity to show leadership on this and join PEI in the Yukon in implementing comprehensive gender affirming care. As well, the Manitoba NDP has the most gender diverse caucus in Canadian history. We've elected a trans man, and we have a non-binary health minister. So I think there's a lot of opportunity there for leadership from Manitoba, and I am looking forward to seeing what that government will do on this issue. I guess as well, we should continue to improve our survey practices in government. It might seem small at first glance, but there are so many downstream effects to erasure in data. If you don't count in data, you don't count in the policy discussions. So this is really a first step to future policy to come.
Dylana, where can people find more of your work?
I don't have a super big social media presence. I could say follow me on LinkedIn, but that's kind of boring. We can spend all day thinking about policy, but at the end of the day, it really comes down to trying to change policy. And it's been a pleasure and an honor to work with a group based in British Columbia, working to improve gender-affirming care policy in British Columbia and across Canada. They are called the Society for Advocacy for Gender-Affirming Healthcare, or SAGA for short. We are on Instagram at SAGA, SAGAH.ca. That's our Instagram handle. As well, we have a website of this same name, SAGAH.ca. So feel free to check us out there. We're going to be launching a campaign in November, and barring a outcome that none of us are hoping for in British Columbia, we don't know the results in British Columbia yet. We remain very hopeful that we can see some improvements in British Columbia, starting in British Columbia, moving across the country on gender-affirming healthcare.
Dylana Thompson, thank you for joining me on this episode of the Perspectives Journal podcast.
Thank you.
That was Dylana Thompson, policy researcher and author of Counting the Dead, the urgent need for coroner's data on trans deaths in Canada, which you can now read in Perspectives Journal number 2 in print and online. You can also read the full NDP white paper on the status of trans and gender diverse people, linked in our show notes. And if you like this interview, share and subscribe to Perspectives, a Canadian journal of political economy and social democracy, on all major podcast platforms, as well as Press Progress's Sources podcast that digs deeper into the news stories you won't find in the major papers. The Perspectives Journal podcast and Sources are proud members of the Harbinger Media Network, Canada's progressive podcast community. You can read more in Perspectives Journal, a publication of the Broadbent Institute, by visiting perspectivesjournal.ca.